Early versus late perimenopause. What actually is happening in your body? Let me guess. You're in your late 30s or 40s. Your labs are normal. Your periods are still coming, but you feel anxious, exhausted, not sleeping, gaining weight, and nothing about your body makes sense anymore. Here's the truth. No one told you. Perimenopause is not one phase. And if you don't know whether you're in early or late perimenopause, you will get the wrong advice. Before we dive in, hit like and subscribe because it helps this content reach more women who are struggling and not getting answers. Welcome back to the channel. I'm Dr. Rebbecca Hertel. I'm a board-certified osteopathic medicine physician and certified menopause practitioner, founder of Osteopathic Midlife Health, where we care for women virtually across multiple states. Today, we're breaking down early versus late perimenopause, what's actually happening in your body, why your symptoms change, and why this distinction matters so much for treatment. Because perimenopause is not one phase, and understanding where you are can completely change how we evaluate symptoms, labs, and treatment options. So what is perimenopause really? Perimenopause is that transition phase leading up to menopause, which is defined as 12 consecutive months without a period. But here's the problem. Most women think menopause happens suddenly, and it doesn't. Perimenopause can last 7 to 10 years, sometimes longer, sometimes shorter. And it is driven by ovarian aging. Lifestyle stress and those other types of things can also affect it, but the ovaries don't shut down overnight. They become erratic, inconsistent, and unpredictable. And that's why symptoms feel random, because hormonally they are. Early perimenopause, the confusing years, they typically range anywhere between the late 30s to early to mid 40s. So what's happening hormonally here is that this is where most women often get dismissed. In early perimenopause, estrogen levels often are normal or high, ovulation becomes inconsistent, and progesterone production drops first. So what you get is hormonal imbalance. This is why women are told their labs look normal. And yet, you feel awful. Some common early perimenopause symptoms: short cycles or cycle and variability, new or worsening PMS, anxiety or irritability out of nowhere, sleep issues, especially early morning wakening, breast tenderness, heavier periods, migraines around your ovulation or your period, weight gain despite unchanged habits. This is progesterone loss plus estrogen volatility, not estrogen deficiency, and this distinction does matter. While early perimenopause is often misdiagnosed, in early peri, women are often told it's stress, it's anxiety, it's depression. You are too young for this. How about we try an SSRI? Try birth control pills without explanation. But what's actually happening is that your brain and nervous system are reacting to the loss of hormonal predictability. Progesterone is calming and it supports sleep. It modulates GABA. When it disappears, anxiety shows up fast. Late perimenopause, which is more of this decline range, and the typical age range is the mid 40s to early 50s. And what's happening hormonally here is that this is where hormone levels actually begin to fall, not just fluctuate. In late perimenopause, this is going more than 60 days without cycles. The estrogen levels tend to go down overall, and progesterone is minimal, if not absent. Ovulation is rare, cycles become skipped and prolonged, symptoms become more physical, more disruptive, and more classic. Common late perimenopause symptoms: missed periods, more than 60 days. You may go 2, 3, 4, 5, 6, 7, 8 months. Worsening night sweats, worsening sleep disruption, brain fog, vaginal dryness, irritation, lower libido, joint pain, fatigue that doesn't resolve with rest, central weight gain, your typical hot flashes, mood changes that feel very different from anxiety. And this is when women start saying, I don't recognize myself. So some of the key differences between early versus late perimenopause. In early perimenopause, estrogen often is higher than normal. Progesterone starts to decline. Cycles become mostly irregular. Symptoms feel chaotic and mood-driven. labs can look normal, women feel dismissed, and then late perimenopause, estrogen is typically lower, progesterone is almost pieced out, cycles again are absent or irregular, their vasomotor symptoms are typically clearer. This is the same transition, but very different physiology. And why this distinction matters for treatment, this is where I really want you to hear me. Early perimenopause and late perimenopause are not necessarily treated the same way. What helps one phase may worsen another. For example, some women feel worse on estrogen too early. Some need progesterone support first and do really well. Some benefit from cycle-based strategies. Some are appropriate candidates for hormone therapy, and some are not yet. So this is why timing matters, dosing matters, delivery method matters, and individualized care matters. There is no one-size-fits-all approach. So when do you seek help? If you're in your late 30s or 40s, still cycling, but not feeling like yourself, being told you're fine, being offered anxiety medications without explanation, or being ignored entirely, you're not imagining this and you are not too early. So if this episode helped you understand your body a little bit better, make sure that you like and subscribe and share it with other women who need validation. This is exactly why I do this work. Education first, clarity always. And remember, perimenopause is not the beginning of decline. It's a transition. And it's a transition that deserves support, not silence. I'll see you in the next video.